Today we're going to talk about what exactly is trauma. My name is Kami Tahyi, and I'm a counselor and adjunct program therapy supervisor at Perry Behavioral Health Choices in New Lexington, Ohio. Trauma is the Greek word for wound, and although we typically think of it as a physical wound, it can refer to emotional wounds as well. Consider what you know about physical wounds, what you know about a scratch or a broken bone. We know that there are bigger injuries and smaller injuries. We know that everyone heals differently. We know that if a wound is attended to right away, it heals better. We also know that some wounds require more intensive therapies, surgeries to remove a bullet or other things like that. We know that wounds leave a scar. There's a very big similarity between emotional wounds and physical wounds. What causes trauma? There's a variety of things that cause trauma. And we really can't even consider what causes trauma to one person and not the other. But it is important to remember that it's not just experiencing any of these abuses or violence, but it is also being the witness to those things. So a child that witnesses domestic violence between their parents. Definition that I love is traumatization occurs when both internal and external resources are inadequate to cope with an external threat. We are created to survive, and we will do so at great cost sometimes. So many people may say they've been traumatized, and they have if they believe it. But there is a difference between stress and trauma. And stress is just anything in our life that upsets us or upsets our balance. But trauma is actually damage to the mind that occurs as a result of a distressing event to that person. So this is the criteria for a diagnosis for post-traumatic stress disorder. And you can see it's a lot of words. But don't get hung up on the idea of a disorder or being considered a person with a disorder. This is just shorthand terminology that counselors and clinicians and professionals use to just communicate rapidly a set of symptoms that a patient or client has. Also, a symptom is just even another word for a challenge in our life. So the challenge tells us that we need to find something to overcome that challenge. Trauma survivors have those symptoms or challenges instead of memories, Harvey says. And I've always liked that because a lot of times trauma shows up in a variety of ways. In substance use or addictions, panic attacks, numbing, loss of interest, and even shows up in the body in physical symptoms, irritable bowel syndrome, heartburn, things like that. There's a really good book called The Body Keeps the Score by Vanderkolk that I love for trauma information. So we recognize that there's a problem. What do we do about it? Well, there are a lot of different ways that trauma is treated or stress disorders. However, there are basic stages of healing that all of them follow. Fairly simple, not simple stages, but sound simple in writing. And they involve finding safety, and then remembering and mourning, and then reconnecting. And the fact of the matter is, it's not always good to open that can of worms right away. A lot of times people think if they just talk out their trauma that helps it. In fact, there are times if that safety is not established in the body and in the mind and the spirit, that they can actually cause more trauma. So finding that safety may be all that you do, and that is fine. If you are able to, in some way, various ways, get to the remembrance and mourning, and then a reconnection with yourself, finding a new meaning about what happened or what you experienced. It's actually a very beautiful thing. Trauma healing involves compassion and a bit of spirituality. So the trauma wisdom is to first regulate, then relate, and then reason. So a person very upset or going through stress or anxiety, the best thing is not always to say, what's going on? What's wrong? That is a little bit um, above what they're capable of. So regulating the person, do you need a glass of water? Would you like to sit down? Would you like a piece of candy? And then relating with them and maybe perhaps saying, wow, you really look stressed. And then perhaps you can get to the reasoning phase of finding what's happening. So these are just some therapies that work. And they all go with those basic stages that I mentioned. They all are premised on it. And obviously, there are different people that study the different ones and have the different specialties. And it is a work. It is a work. Just like that physical wound, that sometimes when a physical wound is healing, it's painful. As well, an emotional wound maybe too. So we know that trauma creates change that we did not choose. I love this quote. But healing creates changes that we do choose, and we can be empowered in that healing process. For more information, contact your local behavioral health care provider agency or the Mental Health and Recovery Services Board. Thank you very much.